Hello, everybody. My name is Sylvain Rochon. I am the Paradise Engineer, and today I want to talk about, guess what? The coronavirus, COVID-19. Specifically today, I want to just make it very short. I want to make this video helpful for now. Again, more people are kind of talking to me, sometimes messaging, and I watch the news, and I want to put my 2 cents in about all this. You have to put these things in perspective. I am absolutely not afraid of this at all, but the media in general, like, you have to understand, the media is there to sell views. They want ratings. That's the business of it. So they often sell fear. So they over-exaggerate and they accentuate a lot of things and makes us stress out, especially those of us who don't have good information. And that makes people do crazy things out of fear and concern. So we have to put things in perspective, and that's why I'm here, okay? Now, I'm not a doctor. I am a biochemist by training and chemical engineer, and I have a bunch of degrees, okay? And fairly knowledgeable. If you follow my videos, you can tell I read a lot as well. So I can tell you a few things about this particular disease to guide you, at least guide you out of fear and try to make sense of what you're bombarded with constantly. Now, first, in the media, they tend to call it a deadly disease, and they focus on the deaths and the hospitals. While there is a lot of truth to that, there's a lot of excess emotion attached to it. Again, to put things in perspective, this is not the end of the world. Even though we're self-isolating and the economy is going bad, it sounds very, very terrible. It's not that bad, as in the sense that it's not the Black Plague or the zombie apocalypse, okay? It is pretty bad. But the perspective is this. We're looking at about, let's say, and we don't know exactly because we have to create the models, but we get a sense of, because we've been living with it for a while and we've gathered a lot of statistics from a lot of countries. The sense is that about 1% of people that will catch this disease will die, okay? And it's pretty bad. It's about 10 times more serious than influenza. Now, if you put that in perspective, most people are not concerned by catching the influenza. It's a fairly common thing, and you just kind of go through it. So this is 10 times more. So instead of, the influenza kills 1 person out of 1,000, in this case, it's 1 person out of 100, okay? So it's 10 times more serious. Still, similar to influenza, most of those people that do succumb from the disease are people that already have a condition. They're already weakened, either because of advanced age, their body just can't manage the disease as well, or they have some kind of autoimmune disease, or they have a weak immune system. They have other conditions that increases their likelihood they'll have issues with their, in this case, with their breathing apparatus, because it is a respiratory disease, okay? So if you don't have any of those conditions, that percentage, that 1%, which is an average, goes much lower. So it's more about 1 person out of 1,000, okay? Now, sidebar, from what I've heard, a lot of people, maybe up to half of people, are carriers and don't have any visible symptoms or very, very light symptoms. A bunch do have symptoms, and they're pretty bad, as in high fever for long periods of time, difficulty sleeping, aches, like, your body aches, vomiting, not cool stuff, still stuff that you would generally handle at home, but which is, the experts still consider mild because you're not going to the hospital, but unpleasant. Nonetheless, out of the healthy population, it's a very small percentage that actually end up going very serious and perhaps going into respiratory arrest. And part of the reason of that is because it's a novel virus in circulation. We don't have any approved medicine, and which we're testing for. And there's no vaccine, and we're kind of figuring things out. And that's why, the hospitalizations and the chances of it getting serious is much higher this year. Next year, it's going to be much better. Okay? So that's to put things in somewhat of perspective, and then to compare, like the anticipation in the States, which is probably the worst country that'll get it. India may come out on top at some point because of their big population, and they have tested only 100,000 people so far with 5,000 cases. So we really don't know what's going on in India. There's just not enough testing going on, and they have very dense cities and so on. So we don't know. It may end up being worse there. We just have no information. In the U.S. seems to be where it's going to get at its worst. And at its worst, they're talking about 100, 250,000. Well, at its worst, no. Their scenarios are estimated by the end of this year, so in many weeks, to 100,000 to 250,000 cases. And that's from the White House. Whether you want to believe them or not, I think their estimates are a little bit high. That's my own calculation and estimates. I'm not an epidemiologist. They may be right. It may write 100,000 or maybe more, and it's likely. I'm guessing more 50 to 80,000. That's my guess. I'm not that far off. Anyway, that's not much higher than how many people die from the flu, which is sometimes it fluctuates between I think it's 20,000 and 70,000 people a year in the States. Okay, and now the reason it would be that low this time is because of all the self-isolation that are happening. But in context, if you look at past fairly serious pandemics, within the last 100 years, because we can go back to the bubonic plague, where an estimated 200 million people in the world died, about 1/5 of the whole Europe, because the populations were much lower back then. Well, that's pretty serious. Okay, that's really disrupting society kind of numbers. But in the more recently, the last 100 years, you had the Spanish flu in 1918, 1919, that killed approximately 50 million people. That's pretty serious, and that's not that long ago. So the population of the world was pretty decent. I didn't do the research, but I would suspect in the world there may have been like 3 billion people there instead of almost 8 billion now, maybe a little less. A significant number. And some of your grandparents can tell stories about the Spanish flu, and it did disrupt economies and shops, and you can find records of that for a while, and just preceded the Great Depression that happened a few years later. But ultimately, we survived it and went on. This particular virus this year, if the states who have about 4% of the population, if they have let's say 250,000, or let's say 100,000 people that die this year in the world, well, you can estimate having maybe 2 million people dying if you kind of do like a fairly linear kind of comparison and using US numbers as a model. So that's fair. It's a decent chunk, but it's not 50 million people. It's 2 million. Okay, not that bad. If you look at the HIV epidemic, which is still going really in a way, although you don't really talk about it anymore, but it really was really hot in the 80s and 90s because it was new. It was a novel virus that likely came from nature as well, and had a different mechanism of infection. It was completely different from this one. Well, it killed about between 35 million and 50 million people so far as well over many, many years, right? And yet we've learned to live with it. We're okay. So that's the context I want you guys to think about. When the media are talking about like a serious death, and the seriousness is not the amount of people that will die, because we may end up with, say, 2 million people dying, maybe a bit more, even if it's 5 or 10 million people in this year, compared to the Spanish flu or that we passed through and went on to better things later, we'll be fine. The issue, the real issue that can scale things up pretty badly is the healthcare system breakdown. That's the real problem, okay? So the media focuses on all these, for different reasons. Usually it's for ratings. You know, oh, X many people are dying, we want to prevent death, and we do. But as a humanity, we have to live with viruses. This is just normal. There's viruses everywhere. So let's live with viruses. Let's learn how to live with this one. Right now, we want to flatten the curve. You've heard that, and I've mentioned it before in a previous video, because the healthcare system cannot handle this many new cases, sitting in a hospital on ventilators and otherwise, for too long, because we just don't have the capacity or the ability, and we didn't really see it coming too much ahead of time. Usually increasing capacity in hospitals takes a number of years because it's expensive. So, I mean, we're trying to stretch it out by self-isolation, by avoiding too much contagion, yes, to prevent death and disease and so on, but primarily the purpose of all that is so that our healthcare system can remain functioning order, because the healthcare system, guess what, is dealing with all other cases like heart attacks, you know, diabetes, you got accidents, and you got people that suffer from severe influenza, pneumonia, and cancer, and all these things that are common, that are, hospitals were already built to handle all these normal things day to day, where a lot of people die every year. Like, I think the stats in the world, like 2.5 million people die of cancer every year. We'll have that, or maybe a little bit more of this particular virus this year. So it's just adding one more way of people getting sick and die in the smorgasbord of different ways we can die every year. In particular, you know, people that are a bit older and have weaker immune systems and so on. Healthier people have way less chances of dying from any of those things. So the panic that, or the concern we should have, and why we should be responsible in preventing the spread, is a lot more about, well, let's keep our healthcare system intact so that it can scale up and handle the load in this new virus in the ecosystem, into our systems, including next year and the following year, unless we find a way. This virus may not mutate enough so that it would come back seasonally. And if it doesn't, then a vaccine would cut that short, and then we're done. If it does mutate significantly, which we're still looking at because it's a new virus, right? Then it may be a bit like the flu, kind of coming back, and it will have ways to manage that, and we'll be fine. So put things in perspective. Take care of yourselves, but don't stress out on this. If you stress out, what happens? You're helping the virus infect you and make it serious for you. A stressful body is vulnerable to disease and vulnerable to severe impairment. Okay, so that's the perspective I wanted to give you. So here's a couple of things that I want to go over because people are freaking out and trying all sorts of crazy stuff. Okay, first, the situation with masks. Normal masks, including cloth masks that you may just put over your face because you can't find like a regular nurse's mask or an N90 or N95, which N95s should be reserved for the healthcare professionals at this point. There's a very limited supply. Those are masks that will filter out the virus. Okay, it's very hard to breathe through them because you need extremely small pores and a special material to do that. Viruses are they're over 1,000 times smaller than the bacteria, so they're tiny. It's a protein. Okay, we eat proteins, and they're not living in a bacterial or a cellular kind of way. It's extremely small. So those masks are not so much I mean, the N95s, yes, but the surgical masks or the cloth masks, they're useful to a degree in preventing you from having a virus or droplets of water that carry the virus to enter your breathing system. But they may still do that because they're so small, and those are not designed for that. but it's a barrier that would prevent some from entering, or altogether, if the droplet of water is big enough, and often there are when we speak, or when we spit, when we cough, things like that, it would go on the surface of the mask. The virus remains in the water, so you have a barrier. It doesn't touch your mouth or your nose, okay? But it would remain on the surface of the mask. Some of them may go through because, again, these are materials that are not designed for small particles like this, but it could be helpful to prevent that. But what's more important to wear a mask when you go out is that if you do sneeze, or even if you talk wearing the mask, then these droplets, they stay near your mouth. They don't go out and infect others. So it's way more useful to prevent you from infecting others than from you to catching it from others. So if people are all wearing masks, this 6-foot barrier is not that needed, because you're not spitting out bubbles of water containing the viruses if you happen to be infected. And a lot of people will be infected and not know it yet, or will remain asymptomatic. So wearing masks, good, even if it's a scarf or a cloth. It is useful. It is helpful. It won't prevent the virus spread, but it will prevent a percentage of it. So yes. Now, myths about vaccines. A vaccine, many vaccines for the COVID are in the works. They will be out in a few months, maybe over a year. It takes that amount of time to go through testing. You can't just take a virus. There's some examples. There's the Qatar incident that happened, and I forget, the last century at least, where a pharmaceutical company developed a vaccine, which essentially is by taking part of the virus, and then you're injecting parts of the virus, inactive parts of the virus, into the body so that the body can generate antibodies. So when it's in contact with the real virus, it will attack it, okay, like a foreign body, like it should. So be prepared. So that's what vaccines are. Some new vaccines use DNA and use a different method than just the protein capsule that surrounds the DNA of a virus to generate an immune response using a different mechanism. And that's a different case. But in both cases, you got to do proper testing to see to test the way the vaccine is produced. Make sure it's safe. Make sure you're not giving the vaccine to others, because in the case of the Qatar incident, I think that was the company name. They were developing a vaccine for polio, and they gave the vaccine a bit too early before proper testing was conducted to 200,000 children, and I think it was 50,000 of them got polio, and 200 got paralyzed. 50 of them died because there was some active virus inside the vaccine. They didn't do proper testing and proper, checking of the process to make the virus, and they gave the disease to a bunch of people. So you have to do proper testing. You can't let's just guesstimate it, do minor testing, because then you may make things worse, because you're injecting people that supposedly are not infected to make them generate the antibodies. So you don't want to infect them with active virus. The other cases of why you're testing the viruses is that we're using, sometimes there can be chemicals that are added to activate the immune system. Sometimes just through the process of making the virus, there may be some other chemical that may cause allergic reactions and whatnot. And some of the proteins may cause too much of an immune system reaction to some people, because that's what you're doing. You're activating somebody's immune system to generate antibodies. If it's the response is too strong, it may cause more harm than good just by immune response inside the body without infecting the person itself. So we have to be patient about a vaccine. If you hear about a vaccine that is out, no, don't take it. Number one, because you may get whatever, okay? You may get hurt or get sick, die. All sorts of stuff may happen if you get a supposed vaccine that is not regulated, that's not approved by my organization. But the actual good vaccines that are going through the process need to go through that process. Some of it can be sped up. And then some argument in skipping some steps, I guess, for expediency. But you really need to be careful about that, because you are, if you're skipping steps, you're risking on unsound ground with a vaccine tested on people that are not infected. So if a policymakers or a country decides to go that route, it may go well, it may go terribly bad. Okay, so be leery of early vaccines. Sorry, I'm not sick. Okay, I'm just coughing a bit this morning. Now, what is currently available, since we've had a number of people with the virus that have produced antibodies, some of them have been giving blood, we can collect the plasma of these individuals that contain the antibody. Then you can use that as a treatment to inject inside people that are early stage virus or that don't have the virus, to give these individuals the antibody. So that, and these would be, of course, in very limited supply, but that's very useful for people that have compromised immune systems, because you give them the antibody. So that's very helpful for a certain part of the population that would have a difficulty creating the antibodies in the first place. But if we are able to manufacture these antibodies artificially and inject that into people's blood, that would be a different way to kind of generate a vaccine of sorts. And it has its own challenges that need to be tested if you're doing something like that. But taken from plasma, that has been very successful. It's something that is available to doctors right now. So if you hear about that, yes, that is not a myth. That is a real thing, okay? Now, secondly, there's a lot of medicine or people, quacks and snake oil salesmen out there that are promoting all sorts of medicines that are proven, blah, blah, blah. Again, no, okay? Remember the perspective. This is natural human and virus interaction. There's going to be people that get sick. There's going to be people that will die. We can reduce those numbers. Do not panic. Do not succumb to fear and buy all these promises. Even if it's Dr. So-and-so said, usually it's false. The real information is there is some medicine, and you heard a lot about the chloroquine and hydroxychloroquine combined with an antibacterial that have shown some promise anecdotally in tests. And I've read some of those articles, and it looks promising. But I've also read over the specifications of these compounds. These typically they're used as anti-malarial compounds, quite safely under the recommendation of a doctor, or against to suppress somebody's immune system for cases of lupus and other diseases where the immune system is overactive, under doctor's prescription. So they show some promise, but every disease and every medicine has to be tested and has a different impact on the body. Some of them do counteract other medicine, or combined with other medicine create very, very nasty results. And some people in their current condition just would be more harmed by these medicines, okay? So always follow your doctor for these treatments. Just because somebody on TV says, or wherever says, well, this is the cure, they don't know what they're talking about. Okay, this is more complicated. This is not Tylenol, okay? These are drugs that have a profound impact on how the body works. They have fairly serious side effects to some people too. They can be very efficient for certain things. Like the way it treats malaria is extremely different from how it acts as an immunosuppressant for lupus and other autoimmune diseases where the immune system is overactive. So the chloroquine is going to be used for overactive immune system diseases because it suppresses the immune system. Great. It prevents the malaria, which is a parasite essentially, okay, to duplicate. That's great, okay? It's used for a different way because it's a fairly active medical system. What it does, at least, is that it seems to suppress the ICE receptors inside the cells, some of the cells in the alveolus, which are inside your lungs. And that seems, and the virus, this particular virus, seems to want to attack those receptors. So if you have this medicine attached to the ICE receptors, which I use to, for the immune response itself. Well, the virus can't use that mechanism to enter cells. That seems to be what actually the mechanism and how it happens. So it has this specific possible reason why it's been shown as promising in some treatments, because it prevents the virus from entering cells and thus to infect. But to give you an example, these ICE receptors are also used for people that have high blood pressure. There's some medicine that high blood pressure individuals use that actually tickles those same receptors to help the person survive from high blood pressure. Now you have two types of medicine that are competing for these sites, and that combination can be deadly for some people that have high blood pressure. Okay. So do not take those drugs without medical supervision or recommendation, because they know your case, they know what you're taking, they know your body, and they can say, yes, this is good for you, yes, this is bad for you. If you have a compromised immune system, obviously you shouldn't take it, because it will suppress your immune system. If you already have a compromised immune system or weak immune system, you don't want it to be less able to fight the disease. It'll have the opposite impact on you, possibly. Okay? Some of those anecdotal research reports or experiments using hydroxychloroquine, I think it was case with azithromycin. Some of the people could not finish the experiment because they started taking it, and then they went into intensive care, and one of them even died. We don't know why, because the research was not about that. It was about like whether it reduced the amount of viruses in the body. So they followed like 20 people over taking some of these medicines, and 6 of them didn't make it through the 10 weeks. Of the 2 of them were fine. They just were sent home because there was no more virus, so it was fine. But 4 of them went to ICU, and 1 of them died, possibly because of the unknown interaction between the virus and those chemicals and their specific body case. The group that did not take those medicines, none of them ended up in ICU or died during that 10-week period. They were just observed the whole time. They were never rejected. So it's possible that that medicine helped reduce the virus amount in a bunch of people, but helped make the condition more serious to some. Okay? So follow your doctor's advice. Also, to boot, this medicine would be useful to prevent the virus from replicating. So if it's not inside your body, it can only give you the secondary effects or be harmful to you. So again, take it on the advice of your doctor. He'll tell you if it's safe for you to take it, even if you're not infected. He'll tell you if it's proper for you to take those medicines after you are infected. Okay. Again, this is not aspirin. These are strong drugs. Okay. The best thing you can do, because there's no proven medicine right now, past clinical tests that will work for everybody in a clear way. We're still testing a bunch, including the chloroquine, right, and hydroxychloroquine, is for you to stay healthy, even in self-isolation. So eat well, good food, healthy food. Go to the grocery store and get yourself some good food, okay? Sleep well, exercise, drink lots of water. So the basic stuff to be healthy. That promotes a strong immune system, okay? Meditate if you can to avoid stress, or just try to avoid stress. Be happy. Put things in perspective, like I described. Relax. Take measures, just like what you would do with AIDS, okay? take precautionary measures to not catch it. Okay. If you do catch it, well, there's, even with AIDS, there are now drugs and ways to manage that. If you catch a coronavirus, well, stay healthy, isolate yourself, go to the hospital, get treatment, get the best care possible, but don't stress. If you meditate, it'll reduce your stress level. If you understand these rules, and you put things in context, you won't stress, and that will keep your immune system strong. And if you do catch it, you may be one of those that will be asymptomatic or with mild symptoms. And it'll go through, and your body will build antibodies. And even if the virus comes back next year, you have antibodies. You won't catch it again. Unless it mutates too much, but it seems like it's not a mutatee virus. Okay? So I hope this is helpful to you all. Just be happy, man. I mean, we've had viruses before, and this one is not worse than some of the other big ones we've had, and we've gone through them. Take care of the families that are, and be concerned for those that are more vulnerable, and make sure they don't get exposed. Take those measures. Wash your hands. Don't touch your face. Be healthy. And stay away. Just stay away for a while until we do manage things. And it'll be a bit, but we'll be fine. And the silver lining is that during these times of crises, economic or healthcare or otherwise, there's a lot of creative innovation going on, and we'll be even better and stronger as a society afterwards. So just participate in society in the way that is safe. Don't worry. Stay healthy. You're good to go. All right? Bye.